So, why it matters. So, the National Academy of Medicine estimates that medical care, the care you receive directly from a medical practitioner, accounts for only 10 to 20% of the health outcomes. And what are health outcomes? Well, health outcomes are measures of well being, such as your quality of life and chronic disease burden. Do you suffer from a chronic disease? This means that at least 80% of health outcomes may depend on social, economic, environmental factors and their effect. If such a large fraction of health is left unaddressed, says CMS, the Centers for Medicare and Medicaid Services, it may increase the risk of developing chronic conditions, reduce an individual's ability to manage these conditions, increase healthcare costs, and lead to avoidable healthcare utilization. Greater shares of the population experiencing poorer health outcomes can significantly put the health of all Americans at risk by increasing public spending and healthcare costs. These expenditures can limit overall gains in quality of care. So there's one estimate by the Kaiser Family Foundation that disparities amount to approximately $93 billion in excess medical care costs and $42 billion, those are billion dollars, in lost productivity per year, as well as economic losses due to premature death. As calls to reform the healthcare system grow louder, it will be impossible to do so without understanding all of the factors that contribute to health. And like to put this, so this is just really the real dollars around these health disparities. And if we put this in context, we'll go through a few things. One is historically, so this became something that our government started to pay attention to in 1983. 1983. So HHS produced a report on the health of the U.S. that indicated major disparities existed in the burden of death and illness experienced by Blacks and other minority Americans as compared with the nation's population as a whole. So this study prompted a government task force to conduct a study of minority health problems, which produced the report of the Secretary's Task Force on Black and Minority Health in 1985. And this was known as the Heckler Report after Secretary Margaret Heckler. She was the secretary of HHS. And the report offered a startling, compelling account of the prevalence of health disparities among racial and ethnic minorities in the U.S. And this was the first comprehensive government study of minority health status ever. And 1 year later, in 86, there is an Office of Minority Health that was established under HHS, and major healthcare organizations, including the Robert Wood Johnson and the Commonwealth Foundation, began addressing health disparities. So this is not a new problem. It's like over 30 years old, and that this is an issue. And the access to and availability of healthcare services, access to nutritious foods, access to education, employment opportunities, geographic location, all impact the rates of chronic diseases and overall well-being, and exist across all kinds of dimensions, such as gender, age, disability, socioeconomic, geographic location, etc. So taken in all of these factors as it relates to healthcare is crucial for developing policy solutions for all Americans. So there's a couple of things here. The brief goes through kind of the differences between the disparities that exist across these different dimensions. And one is access to healthcare based on insurance and level of population who are not insured, because the cost of healthcare and access to healthcare really leads to impacts health outcomes. So this outlines a survey, and just in a non-elderly population, 0 to 64, for instance, there are like 22% of American Indians and Alaskan natives do not have insurance, and 19% of Hispanics and 11% of Black compares to 8% of white and 7% actually of Asians. So this is one of the metrics here that access is one big issue, and there's a big difference. Do you have like some comment here on access to healthcare?
Yes. And so, many times that there's not enough physicians or healthcare facilities within our communities. Even during this pandemic, you have hospitals that's closing down in certain communities. So there's just not an opportunity for individuals of color to be able to get all of the utilization of healthcare services within their community. So yes, we see that. When you don't have a job, because our majority of our healthcare services is based on if you are employed. If you don't have transportation, you have to rely on communities, clinics, and they're not fully staffed or have the expertise that they need. If you're in a rural community, you don't have the best doctors. You have a lot of physicians who are just out of college and who may not have knowledge of some of the severe illness that impact our community. And then also understanding the different kind of illness that impact different race. Because all of us, our bodies are different. We respond to medicine and particular care different. And if you don't have that education or those skill sets in certain communities, then that is one form of, in my opinion, access to healthcare services.
Yeah.